Pfizer vaccine arrived last week, but some doctors and nurses who work directly with COVID patients say they're having a hard time getting it. As WBZ's Louisa Moller tells us tonight, one of Boston's biggest hospital operators is admitting it has made some mistakes with the rollout.
For months, Brigham and Women's NICU nurse Jen DeVincent has treated some of the pandemic's tenderest patients.
And even yesterday, I was in a COVID-positive mother's room on postpartum.
But when time came to sign up for a COVID-19 vaccine, Jen found herself at the back of the line.
If you weren't on at that exact moment, at that exact time, which I was not, I was caring for babies, so I didn't sign on at that exact moment, we don't get the vaccine.
A week after the vaccine rollout in Massachusetts, some frontline workers are sounding off about what they call a chaotic process. One Brigham doctor tweeting, "I'm an ER doctor, and despite trying everything, I've not yet been able to be vaccinated." Another Mass General doctor saying a first-come, first-served scramble for vaccination appointments explicitly disadvantages people who work more.
We definitely didn't do a good job of setting expectations.
Dr. Paul Binninger, medical director for emergency preparedness at Mass General Brigham, says the system's COVID Pass app, used to sign the hospital workers up for vaccination appointments, crashed when a surge of people sought the first 9,000 doses. And a questionnaire meant to push frontline workers to the front of the line backfired.
And the system that we used really created a sense of competition among staff. That was the last thing, of course, that we want to do.
The new plan to stagger vaccination signups and double the clinic capacity. Jen hopes that really puts Frontline back at the front.
There's been nurse managers that have gotten it before frontline worker staff. There's been unit coordinators that have gotten it. They're not in the COVID patient rooms.
Louisa Moller, WBZ News.